All right, it's really great to be here. I want to first say thank you to the organizers of such an important talk for having me here. And as you heard, I'm an adopted daughter, so I'm no stranger, right? Also, I'd just like to preface my presentation with the fact that this is maybe, I've literally lost count, maybe the 12th time I've given this talk just this year. It's a passion of mine. I just like to spread, you know, information on health and wellness, all right? So let's get right into it. Oh, by the way, there's one gentleman looking at me very keenly. Please, gentlemen, don't feel left out. This talk is for you as well. If you have a wife, a sister, a cousin, anybody that you love that's a woman, this talk is for you as well, all right? Just waiting on my slide to move. All right, maybe you'll have to change them for me. All right, so really quickly, and Mrs. Gordon warned me that I have 15 minutes, so don't worry, I'm gonna keep it short. All right, so I'm gonna talk quickly about what wellness is, why you should pay your doctor a well visit, what are some of the barriers to accessing wellness care, what exactly does the doctor do at my well visit. We're going to talk about the big C, and today the big C could be cancer, it could also be COVID, it could also be crime, but we'll see, right? Continuity of care, I'm going to summarize and then conclude. All right, so what is wellness? Wellness is a state of complete physical, mental, and social well-being. I just wanted to point out that you're not well just because there's an absence of disease. So you're not well just because you're not hypertensive, for example. That doesn't make you well, all right? Next slide. And wellness is important because literally everything that we do and feel stems from and relates to our well-being. Next slide. There are 7 dimensions of wealth. I don't know. Oh, go back, please. Right, 7 dimensions of wealth. I'm going to highlight 2. One is our spiritual wellness, which is what you're taking care of right now, right? And 2, obviously physical, which is what I'm going to talk to you a little bit about. Next slide. When should you go to the doctor for a well visit? All right, first of all, the concept of a well visit is strange to some people because you might be wondering, why in the world would I go to the doctor when I'm well, you know? But the whole point is to visit your doctor when you're well so you will remain well, all right? And these visits should be done at least once per year, but of course the interval is dependent on you. If you have a chronic illness, for example, you may need to go sooner. And as a young lady, I see lots of beautiful young ladies in their dresses this morning. You should really, honing in on my specialty, you should really be thinking of having your daughter see a gynecologist at least to initiate her, right? Between the ages of 13 and 18, when she should definitely have started seeing her periods, all right? But what are some of the barriers to wellness care? First of all, there are some people who are afraid of the doctor. Is that so? They just don't really want to go to the doctor, right? They think that the doctor's examination is intrusive, which in my specialty, it sort of is. We can admit that. Some persons are afraid of the procedures that need to be done. And of course, some people are afraid of the ultimate diagnosis, right? But not knowing is a problem. Knowing so you can do something about it is what we're trying to achieve, all right? Also, there are some cultural norms that prevent us from going to the doctor. There are some people who are like, me not like going no doctor, you know. Or You have a pain, you know, I just go and watch it and drink a little tea, rub my side, bust a little gas, right? That's a cultural norm. But I put to you that watching and waiting is not the way to go, all right? Next slide. Here's a big one, here's a touchy one. Christianity. I have a pain. Oh, the Lord will heal me. There's nothing that the Lord doesn't know. That is true. But the Lord did provide us with doctors to assist. All right? Next slide. What about finances? That's a big one now, right? Many persons are strapped for cash, out of a job, working less than they used to. But I put to you for sure that it is way more affordable to remain well than to develop an illness and then now try to treat it and play catch up. Here's a big one. Most of us aren't going to the doctor because of the pandemic. So we're at home hiding from the pandemic, right? Hiding from the virus, and all sorts of things are brewing in our bodies. We still need to go and check with our doctor. What in the world does a doctor do, though, when I go for a well visit? Well, it's dependent on you, your age, pre-existing conditions, complaints, goals. For example, in my field, I may see a young couple who has just married and they're just about ready to start their family. That's an excellent time to come in for a well visit, right? So we do all the preliminary checks, you know, the checks that the nurse does. I just want to highlight that just these checks alone can tell me so much about you, because when your chart comes around and I see an age of 65, 65 is young, by the way, and I see a blood pressure of 110/70, I'm like, yes, my young lady is doing well. Or I might see an age of 26, a weight of 250 pounds, and then a blood pressure of 180/120. Not doing well. Right away, I have a profile of the patient before I even meet you. Next slide. Then I talk to you a little bit. Next slide. Right? Just find out why you're here, if you have any illnesses, if you're on any medication. Next slide. I take a history. I'm going to go through this a lot quicker than I normally would. But I just want to highlight, women don't like to talk about their periods, right? It's a taboo topic, but it's something that happens to women who have periods every month. And a lot of women think it's okay to suffer with periods, like it should be painful and debilitating. That's no, that's a big no. Or it should be heavy and you need to schedule your whole life around when it's going to come. And God forbid, it should come when you're on the road, right? It should never be like that. So those things I ask about to try and elicit illnesses such as fibroids. Very, very common in our population. Next slide. Here's the big one, right? I'm gonna highlight this big, big one. When was your last Pap smear? How many of my ladies in here have done their Pap smear within the last year? It ought to be done annually, ladies. Check yourself. I see some people snickering under the mask because they're going, Lord of mercy, 2014, 15, 16, right? It's been a while, but it should be done annually. Here's a big question. What were the results? So a lot of ladies are very diligent. You know, they do their Pap. Ask them what's the result. The doctor never called me, so everything must have been okay. Nay, that's not true, right? It is the doctor's responsibility to follow up, but it's also your responsibility to call, Doc, how I don't hear from you with my Pap result, right? All right, obstetric history, number of pregnancies. I saw a lovely little set of twin boys, I think. Things like that we want to know. Any surgeries? Next slide. Do you smoke? Do you drink? Which you shouldn't smoke. And you shouldn't really drink. a little bit. Then I examine. I just want to highlight this big one too. My exam starts as you walk in the room, literally. So if you walk in, you're not really looking me in the eye. You know, you look a little down right away. I'm fishing for mood disorders. That's a big one in women, and we try to pretend that we're okay when we're not sometimes, all right? Or the ladies who have a little pain, but they're young at heart, so they don't want to admit that they have a little pain. I see a little, you know, but you're trying to cover it. I'm watching you, and I'm diagnosing. Next slide. A big one, acne and hair growth for my ladies with hormonal imbalances who are trying to conceive, very common. Next one. Neck swellings, you may be familiar with the goiter. It's a goiter, a swelling in the neck, very common after pregnancy and the menopause, and that can interfere with your entire metabolism. Here's a big one. On the heels of, I actually didn't know Mrs. Gordon, that this talk was supposed to happen in October. I lost track. I don't even remember when I was supposed to come, but most of us know that October was Breast Cancer Awareness Month. Can't overemphasize, ladies, how important it is for you to check your own breasts. Only you and or your spouse can know your breasts like anybody else, right? Better than anybody else, better than the doctor. So I'll give you one. If my patient comes and she says, I think I feel a lump, I examine her, I feel nothing, I'm still sending her to check it out because it's her breast, it's not my breast, right? So I put up this picture of this very abnormal black breast for you. Because one, there are hardly any pictures of black breasts. We always see white breasts in the literature. But two, please note that you see how the skin, the pores are so prominent? That refers to a peau d'orange. We're going into a little bit of medicine here. It looks like the skin of an orange, very abnormal. You notice that the nipple is pulled back a bit, nipple retraction. Very abnormal. I wanted to point those out because everybody talks about looking for a lump, but nobody talks about these other things, all right? Recently, I had two 20-somethings who had a breast cancer diagnosis because they had a nipple discharge, just a little fluid from the breast, not a lump, right? And they had curative surgery. Next slide. Abdomen, this is a picture of a lady with fibroids. Very commonly, I encounter it. Next slide. All right, we're honing in now. The Pap smear. A big part of my pelvic exam is your Pap smear. Now, ladies, we all know it ain't really comfortable to do an exam like this, all right? What I do, I kind of try and chat you out. So by the time I'm done, you know, my patient usually goes, you did the Pap? I say, long time. I ask you, how are the grandkids? How are the, right? It's so important to be relaxed and have it done. It's not a painful examination. It's just uncomfortable. Next slide. And here is a diagram of how it's done. Please note, recommended annually, every year. The year is almost finished, ladies. Have we reached yet? Every year, starting at age 21 or 3 years after your first sexual encounter. Note, I have there, it's quick and painless. It should be, though it's uncomfortable. Next slide. The big C. We all know what the big C is. It's really an uncontrolled growth of cells, and they can spread. Next slide. Just to highlight the most common types in Jamaica, please note that number one doesn't belong to us ladies. So gentlemen, told you this talk could be for you too, right? And you do have screening tests to check for prostate CA. But the other three sure belong to us: colorectal, breast, cervical, and of course, honing in on the Pap is a screening test for cervical CA. We try to get it in the pre-cancerous stage so it can be treated, totally cured. That's the importance of that test. Can there be any good news about cancer? Yes, that's it. There are screening tests for all 4 common cancers. So you don't have to have it and it just goes unnoticed. You go to your doctor and you check. And once you check and it's there and you catch it early, you can treat. All right, let's skip that. What's the bad news right now? We're wrapping up. The bad news right now is that cancer diagnoses have gone down since the start of the pandemic. Why do you think? Do you think that cancers are getting less? They sure aren't. What's happening is people aren't going to the doctor, so they're not being diagnosed. They're home hiding from COVID, and I understand you kind of need to hide from COVID for sure. But if you find the right doctor and the right place and the right circumstances, just like we're all gathered here, you can go to your doctor safely, right? Next slide. Continuity of care. Oh, that doesn't project well. That's just a little concept to say to you that you really need to find a doctor and stick with the doctor that you're comfortable with, because that doctor, he or she will know you every time. So if I see Jane this year, and next year I see Jane, and Jane all of a sudden has lost 10 pounds, she can't tell me how she lost it. She didn't do anything different. Just for example, that's a red flag, and I may go searching for something, right? Colon cancer does that, by the way. That's why I thought of it. So, did I keep you guys? Because we're about to wrap up. Wonderful. And how did I do on my time? Not too shabby. All right. Wellness is a state of complete physical, mental, and social well-being. You're not well just because you don't have pressure or sugar. All right? You should pay your doctor a well visit at least once per year. Once per year, that's all. Some of the barriers to accessing health care or wellness care I have outlined. Can you identify what yours are? Are you afraid of the doctor? Are you hiding from COVID? Which one is it? Why you haven't been this year, if you haven't been? The 4 most common cancers in this country all have screening tests. That's good news. That's good news. And I like to say, and it's also my selfish reason, right? Your well-woman visit to your doctor is your birthday gift to yourself. So I tell my patients, come in your birth month, let's celebrate. Yeah? So they won't forget. That's supposed to be a little joke. I don't know if you get it. So the doctors were short on masks. Haha. Okay, never mind. Next slide. And I thank you very much for your attention. Excellent question. The question is, at what age do you stop doing your Pap smear and mammograms? All right, so your Pap smear, you should really stop doing your Pap smear at age 65 and beyond. I say that cautiously though, because perhaps you don't have to do it, for example, every year after 65. But my 65s and older, I bring them in maybe every 2 or 3 years. It doesn't have to be as frequent, right? But the book strictly says after 65, but our population of women behave differently. We have more aggressive cancers, all right? For the mammogram, there is no cutoff age at the moment. recommended cutoff age, again, in our Black population because we behave so differently. Yeah. Any last questions? No? Thank you so much. I saw some very attentive eyes under the masks. Thank you.